Ang gulo na intro. But anyway, good afternoon po and thanks for joining us. Today is a Wednesday and maganda po yung usapan natin ngayon. It's help, nahihilo ako. Okay? So today po, for those who are new, I'm Dr. Anna York Bondoc po. I am an internal medicine specialist, a pulmonary and lung cancer specialist. I'm also a former congresswoman, the wife of Mayor J, and the mommy po of an 8-year-old. Dito po kami sa San Juan, San Luis, Pampanga. So please join us. We have a YouTube channel, Dr. Anna York. Binuhay ko lang ho yung Instagram ko today, Dr. Anna York din po. And please follow us on FB Live. Kung meron po kayong nararamdaman panghihilo, any experience with getting dizzy, or any problems with dizziness, ilagay nyo lang po sa baba. We'll be glad to answer that. Sa mga nagtatanong po about COVID and other questions, ihuli po natin, but yes, we will accept those non-dizziness questions. So let's listen po to our case today. Start na po. Dear Doctora, I was recently diagnosed with Meniere's disease. And ang nangyari po, nasa sasakyan po ako, I was not driving, when bigla po akong nahilo. Sobra po ang pag-iikot ng sasakyan. So I had to stop and dinala po ako sa ospital where na-work up po ako. I did not have a stroke and I was told that I have Meniere's disease. Doktora, ano po yon? Bakit ako nahilo? So please help me. Okay. So Meniere's disease, pag-i-post lang po, I think I placed the spelling to guide you. It's called Meniere's disease or that's a very, very common form po of vertigo or sobra pong nahihilo. Okay? So, project yan. Meniere's. How to pronounce Meniere's disease. Okay? Or Menieres. It's a French term actually. Okay? So, let's just go through quickly the guide questions po sa paghihilo and then I'm happy to answer all questions. Okay? So, let's start with letter A. Ano nga ba yung nahihilo? Okay? Kasi I've been dealing with this problem. It's very, very common po. People often go to the doctor because nahihilo sila. Okay? So, ang dami pong ano ba nga exactly ang nahihilo? For doctors, the classic meaning po of nahihilo or vertigo, V-E-R-T-I-G-O, lang, is yung parang nagsispin po yung kwarto. Okay? The room is spinning. It's a sensation nakalagay po people say it's a sensation of motion. Sa akin po, parang sa akin, when I always ask people in the US, I used to ask them, is the room spinning? Are you spinning? And then they would say, yes, doctora. Yes, doctor, I'm spinning. Or I feel the room is spinning. Okay? So spin, parang trumpo. S-P-I-N. Ano? Let me project that po. Hindi ko po nalagay yan. It's a spinning motion. Ayun po. Parang trumpo. Ano? And sa Tagalog naman po, I always tell people, para bang umiikot yung kwarto? So, people tell me, Doktora, parang umiikot po yung kwarto. Sometimes people also tell me, Doktora, parang unsteady po yung ko, and I feel like I have to hold on. Okay? So, there's a feeling of unsteadiness. Ang problema po sa nahihilo, ang dami pong lalo na po sa Pilipino, sa English kasi yung dizziness, medyo nakagets na mga tao Sa Pilipino po, lalo na when I moved back to the Philippines after spending 6 years po in the US training, napansin ko po that the word panghihilo or hilo, ang daming meaning sa Pilipino. Merong parang nahihilo po ako, nanghihina po ako. So there's a feeling po of lightheadedness. In the US, it's called lightheadedness. Parang napapaupo, nanghihina. Iba po yun sa vertigo, which is really spinning So there are a lot. Sa Pilipino po, you have to tease out talaga kung ano ba talaga yung panghihilo. So, I'm going to go into that later kasi po, there are issues about the causes of dizziness. So, sige po, next question. So, the classic dizziness, the classic vertigo, the classic Menieres is spinning of the room. Okay? So, what is causing true dizziness? Yun nga po, that's a very good question. Ano nga ba ang nahihilo po sa Pilipino? So, puntahan po natin, one of the ways that I can figure out kung bakit po kayo nahihilo is I always ask people, and very common po ito sa ER ng PGH, usually babae. Usually, namumutla, and usually, yan, nahihilo. So, to be able to understand the problem, kailangan po talaga ng magandang usapan talaga. So, you need to have what we call a good history and a good physical exam. So, usually, how do we start this? Usually, sa PGH, usually, yung tinatanong namin, kumain ka ba? Kasi, ang hirap pong maano yung nahihilo sa nanghihina eh. So, we often ask people, kumain ka ba? What did you eat? If you haven't eaten anything, kuminsan po, parang manghihina ka eh. Pero actually, hindi naman ho yun yung classic na ihilo. Ang problema ho sa Pilipino, parang napapasama po yung dalawa eh. Another good question, kung bata pa po, buntis ka ba? Okay? Kasi marami pong nahihilo / nanghihina na yun pala buntis. So, pregnancy test is always good. Ano po? Another question po sa mga taong nahihilo, ano po yung blood pressure nyo? Kasi yung sobrang taas po, parang nanghihina na nanghihilo, pero sumasakit ang batok, BP na yon. Meron din naman ho, mababa ang dugo, parang nanghihina o nahihilo. Tapos, another good question po is, are there any other neurologic signs? Ano ba, may migraine ba? Nahirapan magsalita? Kasi po, I don't want to scare anyone, but ang true panghihilo po can also be significant of a stroke. Another good question po is glasses. Tama ho ba yung grado ng glasses nyo? Kasi sometimes mga tao, maraming nahihilo, sumasakit ang ulo, kasama na ho yun, and that usually includes an investigation of glasses. Okay? And isa pa po, blood sugar. That's always one of the things that a nurse often tests po sa amin. Ano ba, are you, kasi hypoglycemic, biglang nahihilo. Hypoglypo yung masyadong mababa. Masyado ring mataas, biglang nahihilo. Okay? So, yun po yun. Ang problema po sa Pilipino, nahihilo at saka yung nanghihina, isang na lang yan eh. So, those po, that's the approach po to dizziness. So, I try to investigate those issues first. Okay, next. How to diagnose, First of all, history and PE talaga. And then, another issues po na gusto ko nung malaman is history po ba? Have you been riding a car for a long time? Halimbawa po, bumaba kayo sa Baguio, yung zigzag nakakahilo. The next day, nandun na po kayo kay Doc. Okay? Another very good question, may history po ba kayo ng colds, cough, or viruses? Kasi po, those can, disrupt there is connection between your nose and your ears. Yung paghihilo po, pupuntahan natin yan, comes from your ears and your brain, okay? So kung may colds po kayo, sinus, allergic rhinitis, barado po yung ilong, pwede pong mabara yung tenga, and that can cause panghihilo. Okay? So yun po yun. And then problems with your ears, barado po ba yung tenga nyo? Any problems with with earwax, titingnan po yung inyong tenga. Okay, so how do we approach this? There are two kinds of dizziness po, no? First of all, actually three. Yung hindi talaga dizzy, yun yung blood pressure, buntis, sugar, hindi kumain, yung iba nag-hysterical or nervyos. Out po yun, no? That's not the true dizziness. So we come to the true dizziness, which is spinning. Okay, spinning, I'm telling you spinning. Dalawa po yon, yung central at yung peripheral. Ano po yung meaning ng peripheral? Puntahan muna natin. Magugulat po kayo, but the problem of dizziness actually starts from your ears. So marami po talagang taong may problema po sa kanilang tenga. Because the ears not only help you hear, pero it is the center po of balance also. Yung ating pong inner ear, dun po yung mga may hairs din po yung ears nyo. At yung tympanic canal po, yun po talaga yung pinanggagalingan po ng dizziness coming from the ears. Okay? So yun po yung tinatawag na peripheral dizziness. Okay? It is the most common. Okay? Dito po nanggagaling yung Menieres and yung positional vertigo. Ngayon, there is what we have po, central dizziness. Opo. Yun naman po yung coming from your brain, ano? So, pag may problema po, that includes seizures, epilepsy, stroke, galing po sa brain. Don't panic. Most of the dizziness is coming po from our ears. So, how to diagnose po, no? History, physical exam. Sobrang importante po yon. The third po is a good neurologic exam. Kasi po, kailangan natin malaman if it's coming from your ears or it's coming from your brain. Kung meron pong mga ibang signos that's coming po from your brain, like other issues po, including migraine, seizures, sa check-up po, lumalabas na may iba pa ho kayong kapansanan, then you will need a further neuro workup. But wag pong magpanic kasi majority po talaga is just coming from the ears. So, titingnan din po yung tenga nyo nung ENT. Nabarado na ba yan ng earwax? Problema rin po yun. What is the function po of your eardrum? Another issue rin po yon. And kung lahat po yan na clear, then sometimes we do po a trial of medication. Sometimes we just treat What do we treat with? Usually, CERC, yung tinatawag po nating beta-histine, the most common gamot po talaga for dizziness is CERC, S-E-R-C. Ayun. Ay, hindi po ako bayad ng CERC, ha? Ilalagay ko lang po dito. Ayan. CERC. It's called beta-histine. People often take it po sa Pilipinas. And it is one of the beginning medications po talaga for dizziness. So how to treat dizziness? First of all, find out kung may ibang problems. Kung coming from the ears po, then we can try curing po yung yung cold, cough, cleaning po nung eardrum, ganun po, at cleaning po ng earwax. After that, we can do a trial of medication of beta-histine. And then, further than that, kung mas grabe pa rin ho, it's not getting better, then you need a workup po by a neurologist or an ENT. So, yun lang po. I hope I cleared up a lot of issues about dizziness. So, fact number 1, dizziness is spinning. Ang dami po sa Pilipino, they mistake it for a lot of things. But dizziness is spinning. Number 2 po, mostly it's coming from your ears. Number 3 po, most of it is benign. Kung meron pong indications na galing po sa utak, you need to see a neurologist. And then, sometimes po, we do rest and then a trial po of medication. Okay? So, don't be so worried about dizziness. Most of it will pass. Okay? Don't just drive pag nahihilo po kayo. So, let's answer the questions po. And, excuse me, inom lang.
From one of our viewer, from Mr. Bernard Salas. Doktora, meron akong vertigo. Pag naka-left side ako, nahihilo ako. Umiikot ang buong mundo ko. Ano kaya magandang gawin para mawala ang hilo ko?
Ano majority of it is coming po from Meniere's disease. What is Meniere's? Meniere's po is actually people don't know where Meniere's disease came from. Very common po talaga yan. Sobrang common actually. My mom had Meniere's disease. Usually rest po talaga and trial of medication. It's a disease of the inner ear that can cause vertigo and hearing loss. Sometimes po some people, accompanied by Meniere's po is bumababa po kuminsan yung hearing nyo. You can also have a ringing in the ears po and a sense of fullness po between your ears. So, nobody really knows po what can cause Meniere's disease. May nagsasabi po na stress. Some people attribute it po to diet. Meron naman pong certain foods, changes po in pressure ng inner ear nyo. Yung iba naman pag na-stress, ganun umiiyak. Yung iba po, some people say it's due to salt. So, what to do po? First of all, sir, distress yourself. Number 2, low salt diet. Marami hong nagsasabi, and again, this is not totally proven, that salt might be a cause po of Meniere's. Tingnan nyo yung diet nyo, And then, trial po ng medication. Some people po, as I mentioned, CERC is the most common. It usually gets better po, no? And, ano po siya, mahirap. I've had people who've had Meniere's for years and they usually see an ENT. It comes and goes. Hindi rin po talaga alam ng mga tao what happens. But most of it is benign. Some people try to eliminate po certain foods like coffee, sugar. Ang dami po eh. You can try. And then may trial po ng medication. Okay? Mahirap na sakit po yan.
From Mizari Cruz Larin, may mga uri o klase po ba ang vertigo?
Yes, in fact, I went through them. Sa mga Pilipino po, kasi the word panghihilo po sa Pilipino, it encompasses including not feeling well at panghihina. As I mentioned, we need to find out kung buntis ka, kung nakakain ka, what's your BP, what's your blood sugar, are you emotionally upset? Kasi ang dami hong nahihilo ko, yung pala, they got into a fight with somebody. So, yun po yun. That's number 1. Sa US, number 2 lang yung peripheral and central. Yung sa Pilipinas, naglalagay ako ng number 3 kasi talagang parating nasa ER ito. Yung mga taong nahihilo. Ikaw, Reina, have you ever encountered these kinds of patients sa ER? Yung mga hindi nakakain, yan.
Yes, Doc. Madami po. Pati po sa mga
Diyos
clinic
ko.
clinic po. Usually sa clinic ng mga schools. Yan.
Students also na napagalitan, people na napagalitan. So marami talaga siyang hindi ko naman sinisisi talaga ang mga taong nahihilo. Or taong, sa Pilipino kasi yung panghihilo is equal to panghihina eh. Kaya Hindi mo nakikita yon, Rains?
Yes, Doc. Ako nakikita ko yung relationship nilang dalawa na
Oo.
pag nangihina ka, usually, madalas,
So, yeah. So ako naman I am not judging anyone. Kung nahihilo ka, what can I do? I just need to kailangan ko lang himayin kung saan nanggagaling yung hilo mo. Okay? Whether it's really coming from your ears, whether you're having a stroke or a migraine or a serious neurologic problem, or whether something emotional or something else is triggering you. Okay? So next.
From Miss Sue Villamil Ponzalan, thanks po, Doc. May positional vertigo po ako. Dati po sa taas. Sa taas ng BP, ear infection at severe flu. May iba pa po bang causes ng vertigo? Thanks po.
Thank you so much. That's a good question eh. Definitely, I had this story when I was still a med student. I was actually reviewing for the boards. The barkada of my brother came to my house and said, "Nahihilo ako, Ana." I asked him one question. Did you just have a cold? He was like, "My God, you're an expert." So talagang having a cold, having sinus problems, having a sinusitis. Ayoko sabihin having COVID na. There's a tube, a eustachian tube that connects your yung sinus and nose system with your ears. Pag nabara po yan, that can cause dizziness.
From Miss Lynette de la Cruz, Doktora, ako po kapag nahihilong ganyan, sinarizin po ang iniinom ko.
Ano po, ma'am? Pakiulit lang.
From Miss Lynette de la Cruz, Doktora, ako po kapag nahihilo ng ganyan, sinarizin po ang iniinom ko.
Yes, some people are, there's a trial of medication po. There are about 3 or 4 medications that you can try po.
From Miss Heidi Borbon Garcia Alqueza, hi Doktora Ana, watching here from the Sol, Pangasinan. Pa-shoutout po ka rin kamag-anak kong Barangay Santa Monica.
Wow. Hi and shout out from the relatives in Barangay Santa Monica. San Luis ba yung barangay?
Yes po, San Luis po yan.
Okay, next po.
Wait, sorry, we have another shout out here. I just wanted to read it, Good evening po. I think this was yesterday, Doktora. Pwede po bang mag-request ng birthday greeting sa youth leader na si Sir Christian Guevara, President of the Kayanakaning Masantol and Masantol Chapter President of Sagisag ng Kabalikat Civicom. Happy birthday, Christian. Ayan. Thank you.
From Miss Sally Cruz Larin, magandang araw po, Doktora. Ang ate ko po ay 72 years old at madalas pong mahilo kahit nakaupo lamang, nanonood ng TV o nakikipagkwentuhan. Okay naman po ang kanyang BP at sugar level. Vertigo po ba ito? Ano po ang mga dapat gawin? Naoperahan na rin po siya ng katarata pero bago pa man po ang naging operasyon noon ay madalas na rin siyang mahilo. Matagal na po.
Is this real spinning? Yun talaga yung problema ko sa mga Pilipino. A lot of us say nahihilo, but parang sometimes it's just feeling weak And sa atin kasi, parang sa atin nahihilo na yon. Kung talagang spinning po talaga yung kwarto ni ate, and most of it happens actually when people lie down or when they change position in bed. Though nangyayari rin like itong nangyari po sa chief of staff namin, nakaupo So yes, it is possible. Ang advice ko po, kung talaga pong spinning, patingin ho muna kayo. Kasi syempre we want to rule out the more serious cases. And ang masama po talaga, ang Menieres or ang positional vertigo, yun po yung last, para bang naimbestiga muna, yung iba sinisiriskan pa yung ulo, ganun po, no? Sinisilip po yung ears. And Menieres or positional vertigo is usually the last diagnosis na po. Pag na-clear na hindi ka na-stroke, wala ka epilepsy, okay BP, okay sugar, lahat yon, pati yung tenga mo. And then they will just tell you probably have positional vertigo or Menieres. Kung ganyan ho, kasi I hesitate rin naman po to just tell someone you have Menieres or positional vertigo. Actually, as you approach this, pwede po to have a trial of medication muna. Pero, if it's getting worse or it's not getting better, dapat po makita yung tao kahit once or twice lang po ng isang neurologist just to make sure na wala pong ibang nangyayari.
From Miss Jacqueline Marquez.
Sorry. So yung question ni ma'am, yes, it's possible na may vertigo po si ate, lalo na kung normal naman po lahat, it's spinning. But in that case, I would suggest po to see a doctor also.
From Miss Jacqueline Marquez, Doc, ako po, may vertigo, halos 8 years more na po. Masakot pag sumumpong, Doktora. Pakiramdam ko po umiikot lahat. Umaalon-alon po pakiramdam ko. Nagpa-test na po ako ng dugo. Normal lang naman po lahat, pati BP okay lang naman po.
Ma'am, yes, it's really difficult kasi pag talagang na-test na po lahat, and they tell you that you have vertigo or Menieres, usually by that time, natingnan na lahat at wala talaga. It's difficult. Usually may trial po medication. Some people po will give, there's a gamot, it's a diuretic to reduce the fluid po sa ears. Yung iba naman po will try and modify your diet. Try mo yung low salt diet, ma'am. Some people po avoid certain foods, allergies, stress. Yun po yun. Kumbaga, pumupunta na tayo sa sitwasyon po na talagang avoidance na lang.
Promise mga lubnan, Joanne Makapugas. Ako po, Doktora, pag yumuyo po ako, bigla na lang po akong nahihilo. Di ko po madilat ang mga mata ko kahit nakapikit po ako. Pakiramdam ko po ay umiikot pa rin.
Yes, it is very difficult po. And these are patients that are difficult to treat, ha. Ako nga, pag hindi ko na talaga makayanan, pinadadala ko sa neuro kasi parang nauubusan kami ng ng dapat gawin. It's a difficult disease po without any real beginning or end. So, ho talaga, yung iba ho, diet modification po talaga or yung iba nagte-therapy, yung iba nagpapa-counseling, yung iba naman ho, maingat na lang ho talagang umakyat sa kama kasi kung minsan biglaan lang ho talagang ayun na. And bigla hong dumarating, bigla hong nawawala. Yun po yun.
Okay, from Mizari Cruz Larin. Ako po, kapag di natama ang grado ng salamin na gamit ko, minsan nahihilo o masakit ang ulo.
Yes, that is true, Ma'am Zari. That's why, when someone presents with dizziness, ang dami nyo talagang kailangan, sometimes I send them muna to the eye doctor just to check their eyes din po talaga. Ah, pero talaga yung classic, umiikot po yung kwarto, that's vertigo talaga eh. And that is usually coming from the ears. Next question po.
Hello, sorry Doc, nakamute pala. Doc, ako po,
It's
every time
okay.
mag-travel by car, tapos di maiwasang mag-cellphone at magbasa ng message, sobrang nahihilo po ako.
Yes, that is true. That happens to a lot of people. So, meron pang issues, Reina, that it is genetic. Kasi may mga taong sobrang nahihilo, may mga taong hindi eh. So, sa mga taong nahihilo, sa sasakyan, I often advise them to open the windows. Kasi talagang sometimes magsusuka talaga sila. Meron kami mga kasama talagang biglang nagsusuka sa sasakyan eh. Some people find it useful na nasa harap sila so that they can see the road. Kasi nahihilo sila na nasa likod sila. Parang gumagalaw na wala silang nakikita. Ganon. And then, there are really people po who would benefit po from some people take beta-histine before before they ride a boat, before they ride an airplane, and yung iba before very long trips. So, yun po naman, that's not really the classic vertigo. Those are people po na yung adjustment po ng kanilang ears iba po or more sensitive, I would say.
Okay, I think we have last one. No, not yet. Kailan, for Miss Jacqueline Marquez, kailan lang po ako natumba, doktora? Bigla na lang kong sumumpong. Sobrang sakit po.
That's really a problem that somebody, if you have vertigo and biglang it happens, it can be actually dangerous kasi po may nahuhulog talaga. I advise people, ako po, I personally advise my patients not to drive. Kasi baka po talagang may mangyari.
From Miss Juby Gatbonton, Doc, pag sinumpong ako ng vertigo, madalas umiinom lang po ako ng Sinarezine. Ayos naman po BP ko.
Yes, some people respond very well. A lot of people respond to a few days of medication po. But hindi po natin alam, so that's why I say it's called a trial of medication. Kasi there are about 3 or 4 gamots po that you can try and the doctor will try you po on them. Some people respond better to the other gamots. Hindi po natin alam bakit yung iba nagre-respond at bakit po yung iba hindi nagre-respond. Ang hirap. Opo. So that's it.
Yes, Doc, I think that's all that we have for
summary na
today.
lang po, no? This is what I could say po about dizziness. In the Philippines, dizziness can sometimes be confused with lightheadedness or panghihina. So the classic dizziness is really spinning po, vertigo. Majority of it is going to be benign. In other words, not serious. Ang problema lang po talaga, pag nahulog po kayo sa Menieres or yung positional vertigo, para siyang it's not that easy to treat. Nawawala lang po minsan kusa. So how to treat? Be very careful po if you have it kasi baka ho kayo talaga mahulog, do not drive. Number 2, there is a trial of medication po na mabibigay po ng doktor. And number 3 po, you can also try po diet modification, avoidance of stress, avoidance po ng mga nakakanerbiyos, they can trigger Meniere's disease. And lastly, if you have it, nakakaabala ho talaga siya and it's really annoying. Pero rest assured, it's not gonna lead to cancer. Hindi po siya magli-lead sa stroke. Hindi rin po siya magli-lead to heart attack. It's a relatively benign disease but very nakakainis at nakakaabala. But again, try the medications. They might work. And lastly, kung talaga pong nagpe-persist, dapat po tingnan na rin po talaga to make sure that just na yun lang ho talaga sakit nyo at wala na pong iba. So dizziness is annoying but we can do something about it po. Okay? So sa inyo pong lahat, magandang hapon.